You ready?
Good?
Yeah.
Okay.
So you're gonna be looking at me.
Okay.
I wanna make sure that I can see you in it. There. Okay. All right.
Hello.
Okay. Please tell us who you are, your job title, what your position entails, any specialties.
Okay. So I'm Amy Bernards. I'm a physician assistant, and I practice dermatology.
Perfect. Any else that like goes into it? How many years have you been doing it?
I've been a PA for 15 years and have practiced dermatology most of that time. I sort of specialize in skin cancer treatment, and so I certainly treat all ages, but acne, warts, the rashes, those are kind of medical dermatology is my specialty.
Perfect. That's great. What's your personal patient care philosophy? What would you like your patients to know?
I think it's super important that you should always come in if you have questions. So many times people feel like they can't come to dermatology if they're not sure what they have or if they're afraid it may be nothing. And so I always say, when in doubt, check it out. So I'd much rather have people come in if they are concerned about something.
Awesome. Okay. What is it like to work at Richland Hospital, your coworkers, the culture?
I love practicing rural dermatology. So I grew up in a small town not far from here, and I live in a big city. So I choose to commute to a small town just because I like the vibe. I like the feeling of being able to help people. Skin cancer is very prevalent in our farming culture and community. So I just always choose to work in a small area.
Perfect. Do you have any, I don't know if I have this on. No, I don't think it's on. Sorry, I can hear a little bit of music. Okay, do you have any, this might be like a loaded question, so bear with me. Do you have any happy patient interactions that still remain in your mind today? What was the situation and what was the outcome due to your patient care strategies? So it could be, I know you have a lot of patients, but it could be something like, someone was scared that they might have had skin cancer or a mole that they wanted removed, or like something like that that just sticks out in your head.
So I would say I treat all ages, so it's super important to me to have people feel really comfortable when they come to their appointment. Diagnosing melanoma is probably one of the most challenging because it's a super scary diagnosis and people are afraid when they hear it. So I always find like that's important for me to reassure them. It's usually the patients I find I have a close bond with too, because we see them every 3 months for a long time. I do have one patient who has a ton of skin cancers, and so I've been treating him for years. And he actually will fly from California to see me still. I have another patient who I see multiple times a year because she's had multiple melanomas. So, once we start to get to know each other, she asks about my kids. I ask about her kids, so we just get to know each other. So I always feel like people should be comfortable when they come to their doctor's appointment and see their provider, and that's my goal.
Perfect. Okay, I didn't have this on the list, but any fun facts about your life? Like, do you have any hobbies that might, entail hanging out with the community that you see on a day-to-day or anything like that?
Yeah, so I have a twin sister.
Awesome.
Who's also a PA. She also works in a rural setting. I live on a farm, so we just moved there, and so we're restoring our 100-year-old farmhouse. My son raises chickens, and we pretty much play on the lake. We own a lake house up north, and that's usually where we are found on most of our free time.
Awesome. Okay, I lied. One more question.
Sure.
We can do, so this is going to be like a short minute or less video. If you want, we can schedule other times to do like, I know I keep saying sun tips, but like anything in like the summer, we could do it right now too. Like anything you want people to know, this can be like a different clip too. Just about like summer months, protecting yourself and stuff like that.
Sure. So I always encourage people, we have a lake house, so I encourage people to be super active, get outside, especially for what we've been going through. We've all been quarantined. It's great to be active and be outdoors, but you have to be smart about it. So my biggest tips are make sure that you have replaced your sunscreen. It does expire like medication. Make sure that you choose a 50 SPF or higher. Try to apply it 15 minutes before you go out so that it actually soaks into your skin. Make sure that we use enough. Most of us don't use enough sunscreen, so we should be actually using a shot glass full of sunscreen for your body. and then reapply every 2 hours. Don't forget parts like your ears, your lips, and your scalp. Those are the areas that are most prone to sun damage. Make sure that you always have sunscreen on your face year round, so you can find those in a lot of great moisturizers. And then just be active and enjoy it. Try to wear a hat. You know, keeping covered is actually number one for my tip. Sunscreen number two. So if you can make those healthy choices, then you get to enjoy the outdoors even more.
I think we are good. Do you have anything else that you want to add that I didn't ask? That you want people to know?
I think those are the biggest things.
Okay.
So,
I think we're good for now.
okay.
Thank you for doing this.
Sure, no problem.
I'll be